Welcome back. It is Wednesday, March 4th, 2026. And I'm just absolutely thrilled you're joining us today.
It's always a pleasure to be here.
Having you, the listener, right here with us at the center of this experience, well, it's literally what fuels this entire show. We've got a lot of ground to cover today, and I am so glad you're tuned in.
We really do have a lot to get through, but before we dive into today's material, we owe a massive thank you to everyone who tuned in for our last discussion.
Oh my goodness, yes.
The engagement on our breakdown of the Canada Express entry program was, it was nothing short of phenomenal.
It really was.
Yeah.
You all showed up in the comments, sharing your personal immigration journeys, asking these incredibly nuanced questions.
Some really tough questions, actually.
Yeah, exactly. And proving once again why this community is just the absolute best. So, if you are finding value in these discussions, please take a second right now to like, share, and comment on today's deep dive.
It really is the single most effective way to ensure others can benefit from the knowledge we unpack here every week. And we rely heavily on that feedback because the core mission of this deep dive is to explore the vital community issues and, those complex global happenings that are quietly shaping our daily lives.
Right. We take the sprawling data, the on-the-ground reporting, all that broader context, and we distill it down. That way, you can walk away with a crystal clear understanding of the world around you.
And speaking of your feedback, at the end of our last edition, we asked you to drop suggestions for what global or Canadian happenings you wanted us to cover next.
And we read every single comment. We really do.
We do. And based on that overwhelming response, we are tackling a highly requested topic today.
Now, I want to pause here and completely shift gears for a second because this is a heavy one. Today, we are looking at the rising presence of fentanyl on Prince Edward Island.
Yeah.
And specifically what it means for communities, youth, and public safety.
It is an incredibly sobering reality. We are going to be tracing how a historically quiet, famously close-knit province is suddenly finding itself on the front lines of a severe public health crisis.
And we want you to keep the conversation going in the comments section as we work through this. Let us know what you're seeing in your own communities and keep dropping those suggestions for what we should dive into next.
Definitely.
Also, just a really quick administrative note before we start. If you have a product or service and you want to reach our amazing audience by advertising on the show, we would love to connect. Just send a detailed message to deepdive247@gmail.com.
Perfect. So to truly grasp the shockwave hitting Prince Edward Island right now, we first have to understand the baseline.
Right, the before picture.
Exactly. We have to look at the historical identity of the province. For generations, PEI has been celebrated as one of Canada's safest, most peaceful places.
It really has.
It's an island defined by its small, deeply connected communities.
Right, the kind of place where people historically just didn't lock their doors.
Yeah.
Where you know your neighbors, you know their families, and there is this profound built-in level of community trust.
Yeah.
It's this beautiful agricultural and tourism hub with a noticeably slower, much more intentional pace of life.
Which is exactly what makes the current situation so jarring. What we are seeing now is not a crisis arriving with sirens blaring.
No, it's not loud at all.
Right. The arrival of fentanyl on the island has been a quiet, almost invisible creep into communities like Charlottetown and Summerside. It's slipping right in through the cracks of that high-trust society.
And the hard evidence of that shift, it is staggering. Let's look at the sheer volume for a second. In Charlottetown alone, law enforcement seizures of fentanyl have absolutely exploded.
The numbers are wild.
They are. In 2023, police were seizing what was measured in literally just dozens of grams. Fast forward to 2025, and those seizures surpass 1 entire kilogram.
And we really need to contextualize that number for you, because a kilogram of fentanyl is vastly different from a kilogram of something like cocaine or marijuana.
Vastly different.
A lethal dose of fentanyl is measured in milligrams. So to put a kilogram into perspective, that is potentially hundreds of thousands of fatal doses.
Right.
For a geographically small province with a population hovering around, 170,000 people?
Yeah, right around there.
A 1 kilogram seizure is a massive, unprecedented spike in illicit supply for a population that size.
It is terrifying to think about that volume sitting in such a concentrated area. And we have to be clear, this isn't a homegrown issue.
No, not at all.
The drug isn't being produced in local labs on the island. It's entering through external supply chains. It's moving across the Confederation Bridge or coming over via ferries.
It's connected to much larger, highly organized distribution networks operating out of the mainland.
Right.
And that geographical reality totally changes the dynamic of how the drug spreads. In a sprawling metropolitan city, an illicit drug supply might remain somewhat isolated within specific districts or neighborhoods for a bit.
Sure.
But PEI is small. The communities are inherently linked. When a batch of fentanyl crosses onto the island, a small amount ripples outward and penetrates the entire community network incredibly fast.
Which brings us to a crucial point of understanding. Because the word fentanyl dominates the news cycle, but I think the actual science of it gets lost in all those headlines.
It absolutely does.
So let's break down exactly what this substance is. That way you can truly understand why it is fundamentally different from the street drugs of previous decades.
At its core, fentanyl is a synthetic opioid. And synthetic is the operative word there.
Meaning it's made in a lab.
Exactly. Unlike morphine or heroin, which are derived from the poppy plant, fentanyl is entirely manufactured, and it was originally developed with a very specific, highly regulated medical purpose.
Right. For pain management.
Specifically to manage severe breakthrough pain, primarily for advanced cancer patients.
So we are talking about a substance designed for people whose pain is so agonizing that standard heavy-duty hospital painkillers simply do not work anymore.
Precisely. It is a profoundly powerful medical tool. But outside of that highly controlled, microdosed hospital setting, it becomes one of the most lethal substances on Earth. The sheer potency is almost difficult to overstate.
It really is.
It is estimated to be 50 times stronger than heroin.
And even more shocking is the comparison to morphine. I mean, we all know morphine is the gold standard for trauma pain. Fentanyl is 100 times stronger than morphine.
100 times. Let's visualize what that actually means for the human body. Because it's a synthetic, it binds to the brain's opioid receptors with incredible affinity.
It just locks right on.
It does, and it shuts down the respiratory system almost immediately. A lethal dose is roughly 2 milligrams.
Okay, let's paint a picture for the listener.
Yeah.
If you picture a standard over-the-counter Tylenol pill, a lethal dose of fentanyl would look like a few grains of salt sitting on the very tip of that pill.
That's a terrifying visual.
I want that image to stick with you. Just a couple of microscopic grains of salt. That is the literal margin of error between life and death.
And that tiny margin of error is the engine of the current public health crisis. It ties directly into the most terrifying aspect of the modern drug landscape.
The contamination factor.
Exactly. The vast majority of people suffering from fentanyl overdoses are not actively seeking out fentanyl. They have absolutely no idea they're taking it.
This completely upends the old narratives we used to have about drug addiction. The illicit supply chain is secretly mixing fentanyl into almost everything else.
Everything.
It is being cut into cocaine, heroin, methamphetamine, and perhaps most dangerously, it's being pressed into counterfeit prescription pills.
And the economics behind this are bleak, but they're straightforward. Because fentanyl is entirely synthetic, it doesn't require vast fields of crops.
Right, no farming.
No good weather, no massive agricultural harvesting operations like heroin or cocaine do. It is incredibly cheap to manufacture in illicit labs, and because it is so incredibly potent, a very small amount goes a very long way.
So drug networks use it as a cheap filler.
Exactly, to boost the potency of other substances and maximize their profit margins.
But the people actually consuming these substances are completely blind to that. Someone might purchase what they believe is a standard stimulant or a recreational party drug, totally unaware that the dealer further up the chain used a basic kitchen blender to mix in fentanyl.
And because illicit labs aren't using pharmaceutical-grade mixing equipment, you get what's called the chocolate chip cookie effect.
Right, I've heard of this.
One pill might have 0 fentanyl in it, and the pill right next to it in the exact same batch might contain 3 lethal doses. It's totally random.
And that contamination factor leads us directly to one of the most heartbreaking dimensions of this crisis, the severe danger to youth and young adults.
It's devastating. Teenagers have always experimented with substances. That is not a new sociological phenomenon, but the landscape they are experimenting in has fundamentally changed.
It's a completely different world now. A teenager might be at a weekend gathering and accept what they believe is a standard painkiller for a lingering sports injury.
Yeah.
Or maybe they are stressed about finals, so they buy what they think is an Adderall to help them stay awake and study. They're taking a pill, assuming they know exactly what it is, completely unaware it was pressed in a basement lab and laced with fentanyl.
And in those incredibly common scenarios, that single isolated decision can be fatal. The concept of a second chance or a warning sign that might have existed with youth experimentation in decades past that's been entirely erased.
It's just gone.
One counterfeit pill can end a life instantly. The margin for error is zero.
It is so devastating. And it really forces us to ask why a place like Prince Edward Island is uniquely vulnerable to this specific threat.
It's a great question.
Major metropolitan hubs like Vancouver or Toronto, they've been battling the opioid crisis for years. They've developed extensive infrastructure to handle it. But smaller provinces face a completely different and in many ways much harder battle.
They do.
The first major hurdle is simply a lack of awareness.
Right. There is this dangerous, lingering psychological barrier in smaller communities, a deeply ingrained assumption that fentanyl is strictly a big city problem.
Right, the idea that it doesn't happen here.
Exactly. Residents often believe that the quiet nature of their town somehow insulates them from the drug trade. But illicit drug networks, they follow demand and profit. They do not respect municipal borders or historical reputations.
No, I know.
When a population's guard is down, their vulnerability skyrockets.
And you combine that false sense of security with the second major vulnerability, which is stretched health resources. This is a critical pressure point for PEI.
Absolutely critical.
The province is already navigating significant strains on its healthcare system. We're talking about well-documented doctor shortages, long wait times in emergency rooms, and very limited specialized addiction treatment beds.
Just think about the logistics of emergency response on an island. When a batch of highly contaminated drugs hits a small community, it can trigger a sudden cluster of overdoses in a single night.
Yeah.
A small rural hospital system simply does not have the buffer capacity or the sheer number of on-call paramedics that a massive metropolitan network possesses.
They just don't have the personnel.
The emergency rooms become overwhelmed almost instantly, and those precious minutes waiting for an available ambulance can mean the difference between reversing an overdose and a fatality.
Then there is the third vulnerability, which is incredibly sad because it turns the island's greatest strength into a weakness.
Sure.
We talked about how PEI is defined by close-knit communities where everyone knows their neighbors.
Yeah.
Usually that level of connection is a beautiful, supportive thing. But when it comes to addiction, it works against them through intense social stigma.
It is a tragic paradox. In a small town, privacy is inherently difficult to maintain. The fear of judgment is profound. Addiction is still heavily stigmatized, and the fear of the local gossip mill,
Well, definitely.
the fear that everyone at the grocery store or the local wink will know about your family's private struggle, it keeps the issue hidden in the shadows.
People will go to extreme lengths to hide their addiction to avoid that shame. And what happens? That desperate need for secrecy delays them from seeking life-saving help.
It does.
They don't go to the clinic. They don't ask for naloxone. They suffer in isolation until it is simply too late. The community closeness inadvertently builds a wall around the person who needs help the most.
Knowing these deep-seated vulnerabilities, the question becomes, how is the province responding? This is where we see the incredibly delicate balancing act between law enforcement and public health.
Right.
On the enforcement side, police agencies across PEI are taking immediate aggressive action.
They certainly are. The RCMP and local police forces have significantly ramped up their response. This includes increased surveillance operations, particularly monitoring those entry points we mentioned earlier, like the bridge and the ferries.
Yeah.
They are executing targeted enforcement operations to dismantle the local distribution hubs.
And a major component of their strategy is cross-jurisdictional cooperation. Because the supply is external, PEI law enforcement cannot operate in a silo.
They have to talk to other provinces.
Exactly. They are heavily reliant on intelligence sharing with police in New Brunswick, Nova Scotia, and even further west. They're tracking those complex supply chains back to their origins to cut off the flow before it ever reaches the island.
But the police themselves are the first to acknowledge a hard truth. You cannot simply arrest your way out of a fentanyl crisis.
You really can't.
You can put handcuffs on the dealers, but if the underlying demand remains, another dealer will just step in to fill the void. Law enforcement is absolutely necessary to disrupt the supply, but it is only half of the equation.
And that realization is driving a massive shift toward public health interventions. Balancing enforcement requires robust preventative measures. We are seeing a push for widespread public education campaigns,
Which is so needed.
moving away from those outdated generic anti-drug slogans and moving toward honest, factual education about the realities of counterfeit pills and cross-contamination.
It also means scaling up harm reduction programs, making naloxone kits, the medication that can actually reverse an opioid overdose, making those widely accessible and ensuring people aren't afraid to carry them.
Yes.
It means doing the difficult work of expanding addiction treatment services and providing substantial long-term mental health support.
Bringing mental health into the conversation is vital because it addresses the root causes.
Right.
The opioid crisis has laid bare the fact that addiction is incredibly complex. It is rarely just a poor series of choices. It is deeply rooted in other systemic vulnerabilities. We have to look at unresolved trauma.
We do.
We have to look at the severe economic stress facing many rural areas, the housing crisis, seasonal unemployment, and the profound social isolation that can occur even in a close-knit town.
Treating addiction solely as a criminal issue is not just ineffective, it is actively dangerous. When society views addiction purely through a punitive lens, it reinforces that small-town stigma we discussed earlier. It pushes vulnerable, suffering people further underground. It terrifies them away from the medical clinics, the therapists, and the social workers who can actually help them heal.
A balanced approach recognizes that while the illicit supply chain is a criminal issue that requires a police response, the addiction itself is a medical condition requiring compassion. Enforcement targets the poison, but public health targets the pain that makes people vulnerable to the poison in the first place.
Which brings us to the most vital part of today's deep dive: the action required right now. This is not just a theoretical discussion about a faraway province. The lessons from PEI apply everywhere, and collective community action is required from all of us, including you, listening right now.
First and foremost, we must educate young people about the specific, modern risks of drug use.
Yes.
The traditional just say no campaigns fall short when a teenager doesn't even know what they're saying yes to. Youth need clear, non-judgmental education about the prevalence of fentanyl contamination and the extreme danger of counterfeit pills.
We also need to actively dismantle the stigma around mental health. We have to foster open, honest conversations in our homes, our schools, and our workplaces so that people do not feel ashamed to admit they are struggling or self-medicating.
And from a safety standpoint, communities need to report suspicious activity to help law enforcement disrupt those supply networks. But simultaneously, we must encourage anyone struggling with substance use to seek help, and we must offer that help without a shred of judgment.
Right.
Schools, families, healthcare providers, and local organizations all hold a piece of this puzzle.
It's a shared responsibility. We all have to hold the net together.
As we wrap up this analysis, I want to leave you with a final thought to mull over.
Okay.
Prince Edward Island is in a period of profound transition. It is experiencing rapid population growth, increased immigration, and expanding urban centers. These changes bring incredible economic opportunities and a vibrant cultural future.
They do.
But growth also means inheriting the complex, modern social challenges of the 21st century. Issues like sophisticated drug trafficking networks and overwhelmed public health infrastructure are no longer distant problems happening in someone else's city. They are immediate local realities.
The bubble has officially burst.
Exactly. So I pose this question to you, no matter where you live. If the most dangerous threats to a community are not the ones that arrive with a loud crash, but rather the ones that slip in quietly through the cracks while we are looking the other way.
Wow.
What other silent shifts are happening in your own community right now? What quiet changes require early, proactive attention today before they become tomorrow's full-blown crisis?
That is a phenomenal question to sit with. What is slipping in quietly while our guard is down? It is definitely something to critically examine in our own backyards. Thank you so much for joining us for this deep dive. We know this was a heavy, difficult topic, but it is an incredibly important one to understand.
It really is.
We truly appreciate your time, your willingness to tackle these complex issues with us, and your commitment to staying informed. Please remember to drop your thoughts in the comments. Take care of yourselves and your neighbors, stay curious, and keep exploring. We will catch you on the next deep dive.
Thank you.